So hi to everybody, wherever you're watching from. Thank you for joining Safe Care BC to talk a little today about COVID-19 vaccinations. We know that the Provincial Health Officer has issued an order that all staff in long-term care and assisted living will need to be vaccinated against COVID-19 after October the 12th, 2021, in order to continue picking up shifts. And we know that the vast majority of staff are already vaccinated, but there are some people who still have questions, concerns, worries, and that's making this quite a difficult decision. So we're joined today by Dr. Manish Sadarangani from the University of British Columbia to talk about some of those issues that we've been hearing from you and hopefully put some of your minds at ease. So Dr. Sadarangani, thank you for joining us today.
Thanks, Jenny. It's great to be able to join you to talk about this today.
Great. I will jump straight into some of the questions that we're hearing, I think, from our members. So the first one is something we've been hearing, I think, right from the start of this rollout campaign back in December about the safety of the vaccines. So are they safe, and what do we know about the risks and the side effects?
So I think overall, these vaccines, are extremely safe. I think that while the whole timeline from the development of the vaccines up to when they were available, to put in people's arms of, essentially less than a year was very quick, I think a lot of that was due to ways to speed up the administrative process, the fact that the COVID vaccine development was prioritized above everything else. So there was a lot of what I would call queue jumping in terms of not having to wait behind whatever was ahead of you in the queue for the various approvals. The actual approval processes themselves and the review of the data was done in as robust a way as possible. The clinical trials in the beginning, before the vaccines were approved for use, were done in tens of thousands of people, some of the largest vaccine clinical trials that have ever been done before vaccines have been approved. We've certainly approved vaccines with less data in the past that have also been very safe and very effective. And I think that the surveillance systems in place in Canada, in the US, and in other countries particularly are really excellent. And so we've been able to detect extremely rare side effects of the vaccine, but for almost everyone, these vaccines are very safe. We know that, yes, they do cause people more than something like a flu vaccine to have a bit of a sore arm, to be feeling, a little bit rubbish, to have a bit of headache, general muscle ache, and that sort of thing. But the very serious side effects remain extremely rare. And on balance, the benefit of vaccination still significantly outweighs the risks, bearing in mind the risk of getting COVID-19 infection and COVID disease. And I think we've seen how devastating that is as it sort of swept through our community and other communities across the world.
Thank you. Yeah, and I think that's a really important point that I know you made the last time that we spoke about this as well, that it's not the risk of getting a vaccine versus nothing, it's the risk of getting a vaccine versus potentially a much higher likelihood of getting COVID. So the no action option is still a risk in itself. I think
so. And I think that, we're not going to eradicate this virus is the bottom line. So, we're here with this virus that's going to be continuing to circulate in one form or another for many, many years to come, potentially decades. So I think ultimately what that means is that unless you're very fortunate and you manage to not get exposed at all, or, you're going to have to get vaccinated or get infected. And so I know that, if that's the choice, that really it's a bit of a no-brainer in terms of getting vaccinated is way safer than risking infection and the potential short and long-term consequences of that.
Yeah, for sure. And I know there's more and more data coming out every day about long COVID and some of the really devastating effects of that. The next question that we've had through is, I think, linked to what you said about the trial data, but we know we've had some people concerned about the newness of the vaccine and that we have data in the short term, but that we don't know what it might do long term. What would you say to those people who are worried and want to kind of wait for more long-term data?
Sure. I mean, this is a question of sort of how long are you going to wait and how many lives are going to be lost in the meantime. So as I said, I think the we have a lot of data on the short-term safety and the short-term efficacy and effectiveness of the vaccines. We're now getting to that point where, some of these vaccines were put into people in the initial clinical trials over a year ago. So we're now getting that follow-up data getting up towards 18 months for some of these vaccines as well. So I would say, we're starting to get these medium-term data. In terms of long-term, and I guess it depends on how you define long-term, but if you're thinking about, 4 or 5 years plus, clearly that's not going to be available for another 4 or 5 years. For other vaccines, we don't normally wait for that degree of long-term safety data before they're approved and they're used. For the most part, vaccines don't really tend to cause that sort of, any effects on that sort of long-term basis anyway. If you're going to see effects, they're usually within hours, days, maybe weeks, but usually, you're not going to see vaccine-related side effects beyond that. And so I think that, we have as good data as we're going to get. And, I think if we were going to say, well, we want to wait for 2-year data or whatever, then there's just going to be millions of deaths in that meantime. And so I think that you're weighing up a vaccine which is definitely safe in the short term. Even theoretically, there's no reason to think there's significant long-term risks associated with these vaccines. And that long-term risk, I would say, is theoretical, if that. Whereas we know that the risks of COVID infection are real, both in the short and long term. So again, I think that, we can always only do the best we can with the data we have available today. But I think it's, such a imbalance between the benefits and the risks and what the theoretical risks are, that I think that we need to be vaccinating people now and protecting people now as much as possible.
Absolutely. And I think, is it fair to say that the people who might want to wait for, another year of data are very unlikely to see anything new in that year that they continue to put themselves at risk of COVID?
Yeah, no, I agree. I would agree with that. So I don't think, as I said, if vaccine-related side effects tend to occur on a very short-term basis, we don't tend to see long-term issues. So I don't think there's going to be anything really. I think it's unlikely anything in the next 12 months that's going to change that calculation.
Thank you. That's helpful. And then one of the other questions that I know a lot of people have had is about what is in the vaccines. So some of our members and some frontline staff have come to us and said that for the flu vaccine, they feel like they know what's in it and they know what might cause a side effect or a reaction, and they feel like there's less clear and transparent information about what is in these new COVID vaccines.
Yes, I mean, I think this is just a case of just going to where the information is. So if you look at something like the BCCDC website, which has, a separate page on each of the COVID vaccine products that's available and has a full list of all the ingredients, people can go into, so Health Canada have what's called the drug product database. And if you just put into the search engine, Health Canada drug product database, that comes up, and then you can search in there for actually any vaccine or any drug that's licensed in Canada, and it will give you the full product monograph with all of the scientific information, including things like the formulation and every single ingredient that is in there, because that has to be there. So there's full transparency, I would say, with regards to the ingredients that's in the vaccines. I think there's less in there in some ways than there are for vaccines that were produced years ago, like influenza vaccines. So there's just there's not a lot in there. All the vaccines that we have now have the spike protein, which is part of the COVID virus, and then they have different formulations to help the immune system to respond to that and to deliver that spike to the body. So actually, just to go, so the mRNA vaccines don't have the protein itself. They have the RNA, which encodes for the protein. So your body makes the protein once the RNA vaccine is injected, and then the protein is made. And all that else, the really other major component that's in there is a lipid, so a fat particle to stabilize that RNA, because it's not stable otherwise. And then the other ingredients are just there to stabilize it. So things like it can be kept for long periods of time without going off, and that kind of thing. And so given that mostly we're using the RNA vaccines now, I think all of this information is available, and so I think we do know what's in the vaccines, and all of that has to be approved by Health Canada before it's used.
For sure. And for those watching this webinar, we do have a slide at the end that's got a link to that BC-CDC website that's got that information on there. And am I right in thinking that if someone does have an allergy to one of the ingredients in one of the mRNA vaccines, the fact that we have a few vaccines authorized might mean that a different one is safe for them to take?
Yeah, that's totally true. And I think even for people who have, relatively mild allergies to the components of the vaccine, that we're now getting quite a good body of data to suggest that they can be safely vaccinated. So we've had people even in BC who've had what we call fractional dose. So instead of getting the full dose, you get injected with a little bit, and then you wait a few minutes and see if there's a reaction, and then a little bit more, and that's done through the allergy specialist. So I think if someone has a definite allergy to one of the ingredients of the vaccine, then they should be referred to an allergist for further assessment. But we're seeing that even in those cases, most people can be safely immunized with the vaccines. And if they can't, then there are, as you say, there are other products available. So I think it's almost impossible that someone's going to be allergic to ingredients that are in the different vaccines that are available.
That's really helpful, and that's great news for those people who do have an allergy and were maybe worried that they wouldn't be able to get vaccinated and therefore wouldn't be able to keep their jobs. It's good to know that there are still options for them. And I think that's the second half of this next question that we've had a few people asking about medical exemptions from vaccination. Are there any other reasons that you know of that people wouldn't be able to get vaccinated? And are there some people who don't need to get vaccinated, for example, if they've already had COVID?
Yeah, so I'll go through the order of the questions here. So people who've had COVID before, they will likely have some protection, at least in the short term, but everyone makes a slightly different immune response to infection. So we know that some people make a sort of very modest immune response, some people make a very strong immune response that may provide them protection in the future, but we don't know at any individual person, if someone's had COVID, I can't tell you how long you'll be protected from getting another infection after that, and we know that immunity is not lifelong. So I think even people who've had COVID, yes, there may be some short-term protection there, but ultimately, vaccination is still the safest way to maintain that protection in the long term. And we know for the RNA vaccines, the antibody response, for example, you get from vaccination is way higher than you get from infection. So, it's probably not only safer to get vaccination than infection, but it may even be better in terms of protection, with the caveat that we don't know how much antibody you need for protection. In terms of people who are medically unable to get the vaccine, that's from a medical point of view, that's a very, very small group. So right now, really, it's only people who've had anaphylaxis to the vaccine or one of the ingredients before. That's the only absolute sort of contraindication, if you like, and that's a very, very small number of people. Other than that, for most other conditions, there are alternatives that can be done. There are ways, like I mentioned, with the sort of partial dosing that can be done. Occasionally immunization within a healthcare setting, within a hospital setting or a clinic, it can be done to try and look for any of those immediate side effects. We know that there are some very rare side effects that occur after vaccination. So there may be some people who have had one of these very rare severe side effects after the first dose that may be medically recommended not to get the second dose. But again, those are, people who've gone through the process where the adverse event has been reported to public health, has been reviewed by the medical health officer, and then sometimes been seen in a specialist clinic. And so I think that's really a specialist physician assessment that has to be made, because it's very that number of people is very small. And so I think that for the most part, almost everyone should be able to get vaccinated. And then in terms of, I don't know if this is what you were alluding to, the sort of the vaccine cards that are being introduced in BC, as of now, there's no medical exemptions for those events and facilities where people need a vaccine card. And it may be, I know that has been introduced in other parts of Canada, so maybe something that comes in the future.
Yeah, absolutely. And I know that the provincial health officer has alluded to that being under consideration for the vaccine cards, but also for our members, for those working in long-term care and assisted living who right now are required to be fully vaccinated by October 12th. But I believe the case is the same right now, that there's no medical exemption.
Correct. Yeah.
But that's really, really helpful, I think, hopefully for those watching this, that if people think that they might have a medical exemption, you shouldn't assume that you can't get vaccinated because you have some kind of underlying condition, and there will be doctors that can talk to them about that. Is that right?
Yeah, no, absolutely. And then if their own family physician or whatever isn't able to talk to them, then they should be referring them to someone who can. But as I said, there's the number of people who can actually, for medical reasons, not get vaccinated because of a true contraindication to the vaccine is extremely small.
Great, and that's wonderful news, I think, for everybody, that almost everyone has access to these. So the next question we've had is from some people that feel like it should be a personal decision that they take at an individual level as to whether or not to get vaccinated, because it's something that's just about protecting themselves. I wonder if you could talk a little bit about that.
Yeah, so I mean, I think that, we know that this is really about protecting everyone. So I think this goes to all of vaccines, that we try and vaccinate people who are high risk of disease, and we try and vaccinate people who are likely to transmit the disease. And when you have a new virus like COVID-19, essentially everyone is able to transmit the disease. And so, particularly I think for your populations where you have people looking after highly vulnerable individuals who, even though they're vaccinated themselves, we know that some of them are not going to make the perfect immune response to this vaccine, and their protection is probably less than it would be in a sort of younger, healthier adult. And so the other way we can protect them is, as well as all the safeguards are in place, and in the institutions and the personal protective equipment and all that sort of thing, is about ensuring everyone around them is also protected as best they can, and vaccination is one of the best ways to do that. And so this is not really just about protecting ourselves, but also about protecting those people who we interact with, our family members, our friends, and those people who we interact with professionally as well. So I think, and as I said, particularly when we're working with vulnerable people who may not be protected as best as possible because of their own situation, then I think it's important to make sure there's sort of this kind of barrier around them as an extra layer of protection.
Absolutely, and I think that's really helpful for some of the people we've spoken to who have questions about feeling like their own immune system is quite strong and that they're healthy individuals, and saying, I don't know if I need this vaccine to protect myself. I think that's a really useful clarification, that it is, as you say, about putting a protective barrier around those vulnerable residents and those elderly people in our care.
And I think even for the individuals, we have seen, and I have personal experience of very, very healthy, fit young adults who have been infected with COVID-19, particularly early in the pandemic when there was a lot of disease around and there was no vaccinations available, who've suffered really, really badly. So I think it's, while yes, older people are at higher risk, and if you have, other medical conditions, you might be at higher risk, it's not the case that everybody who's healthy is going to be fine if they get an infection and just get a mild infection or get a cold. So I think that it's important to remember we can't predict who's going to be the people who end up getting hospitalized, who end up getting ICU, who end up getting long COVID, and the fatalities. And so I think that I don't think people should be going around thinking because they're young and fit and healthy that means that they're sort of super immune to getting severe COVID-19. I think we've known enough to know that anyone is vulnerable, and we can't predict who that's going to be.
Yeah, no, absolutely. There are certainly no guarantees, and I think looking at the data now, it's quite clear that the only predictor of the people that are in hospital, unfortunately, are those people that haven't yet been able to get those doses of vaccine. Thank you. And I think this is our final question for today, which is questions that we've had in about the discussions about booster shots and a third dose. And some people have been asking, does this mean that the first two aren't good enough? And what's to say that this third one will be good enough? And will there be kind of more and more doses of vaccine?
Yeah, so I think there's probably a couple of different scenarios where we talk about this, and actually so as we're having this, what today is the 10th of September, so NACI, the National Advisory Committee of Immunization, have just announced today about recommending a third dose to people who are immune compromised, or specific groups of people who are immune compromised. And so that's already been starting to be implemented in Ontario, and may well be implemented in BC, maybe even by the time people are watching and listening to this. But so I think there's a couple of different scenarios. So if let's talk about those people who are immune compromised and maybe didn't make a perfect response or a great response to the first 2 doses. So there may be some people where the third dose will only be a very marginal benefit in addition. But sometimes it's just a case of you need to give extra vaccine doses to get that good response, in someone who hasn't made a great response to the second dose. And we see that with other vaccines. So if you take something like HPV vaccine, so human papilloma virus vaccine to protect against cervical cancer, in general, for most people in the population, they get 2 doses. But we know for immune compromised people, they need 3 doses to make an equivalent response to 2 doses in everyone else. And we know for lots of immune compromised patients that they do need extra doses of vaccines or more frequent boosting of vaccines. So I think for that group, there may be some who don't make a great response, but many of them will make enough of an extra response to that third dose to get them above that level of protection, above that level of immune response they need to get protected. I think for the general population, right now, there's no recommendation that everyone should be getting a third dose. I think for that, it's going to be more a case of 2 doses give you very good protection. It's really excellent. Over time, however, that is going to go down. That's the natural cycle of how immune responses go. You get a really good response in the first few weeks, and then over time it goes down. We don't really know yet how long that will take to go down to the point where people are going to be vulnerable again to getting infection. And so I think we're fortunate in BC to have excellent surveillance of that. And so that's under sort of ongoing real-time monitoring to see when, if those cases are occurring. So if we do start seeing a lot of disease occurring in vaccinated people, that may be an indication that we need a third dose. But I think the other thing we don't know, as well as how long that will be, is what sort of disease that will be. So if it ends up being that even we're starting to see infections in people who've had 2 doses, if those are almost all mild infections, there may be not so much of an argument to give a third dose. Whereas if people are getting hospitalized and things again and getting severe infection, then I think that may be more of an argument to do a third dose. So right now, there's no recommendation for giving a third dose in the general population. And that's just a case of watching the data and see what happens over time. And it may be something that comes in the future, but we'll have to see on that one.
Thank you. That's really helpful. And I think just to summarize, I think you've said that it's not that 2 shots aren't good enough by any stretch, but that some people might need a little bit extra to get to the place that that a healthy immune system might have got them to, and that over time we might all collectively need a top up potentially to get our immune response back to where it was.
Exactly, and we're seeing that in some places like Israel, who had a very, very good, very proactive vaccine campaign very early on, and they got very high coverage in their population very early, and they have gone down that route of giving that booster dose. But I think we have to take that in the context of our own local disease. There's differences in the way the vaccine was rolled out. Different vaccines they used, different schedules they used, and so what is happening in other countries may or may not be applicable to us here in Canada because of the way the program was designed. And so I think we need to really rely on that really excellent surveillance that we have to decide if and when that third dose will be needed for the general population.
Definitely, thank you. I think that was all of the questions that we've had in from our members today. I've got some on the screen, as you mentioned earlier, the BC CDC webpage for COVID-19 vaccine information, and there's a lot of really good information on there, as you say, about what's in the vaccines, what the different vaccine options are, how to get your vaccine if you still haven't got it. And there is also a really useful page on there about how to find out whether the information that you're seeing is reliable. So how to decide if something that you've seen about the vaccines is reliable and is based in medical fact. Safe Care BC also has a vaccination webpage if you want any information specifically about vaccination for people working in continuing care in BC, or you can email our info email address directly if you'd like to speak to someone at Safe Care BC. We can try and answer your questions or direct them to the relevant person who might have an answer for you. before we wrap up, Dr. Sadarangani, is there anything else you would say to people who are still feeling worried or anxious about getting their COVID vaccination, feeling like maybe they don't want to continue working in long-term care or in assisted living because they would have to be vaccinated?
No, I mean, I think I would say that it's totally reasonable, totally appropriate, and totally normal to have lots of questions. And we have, as you've mentioned, lots of reliable sources of information for people to get reliable answers to those questions that they have. I think everyone who is working in this environment is doing it because they really want to look after other people and try and for the better health of our society. And so I think remember the important job that everyone is doing, and it's important that we do everything we can to protect those, particularly those more vulnerable people around us. And I know that that's what is driving most people here to do what they're doing, and I think this is part of it. And I think we all want to see a day where at least we can start getting back to even more towards normal than we are now. And I think ultimately vaccination is really going to be the way ultimately out of this pandemic.
Absolutely, I completely agree. Thank you. And for everyone watching, do keep asking questions. Do come to us if you're worried. And we know that this is a difficult and an anxiety-inducing time for a lot of people. So I would ask anyone watching just to remember to have kind of respectful and open conversations with your colleagues and your managers. And in the meantime, thank you for joining us today, and stay safe.